My name is Joseph Kadri. The program today shall be looking at effort of Nigeria's government to eliminate malaria. You all know malaria kills children under 5, kills pregnant women, and of course is responsible for reduction of productivity, at most workplaces. And so what is the federal government doing to ensure that this is nipped in the bud? In terms of vector control, in terms of residual spray, in terms of providing long-lasting insecticide-treated net, and many other interventions. If you stay with us on the program, we shall be having a discussion with the representative of the National Coordinator, National Malaria Elimination Program. Of course, she is the focal person when it comes to the issue of malaria elimination program. Talking about Hope Oboko. She'll be telling us what the federal government is doing, especially the Federal Ministry of Health through the National Malaria Elimination Program Office on these various ways and intervention that is required to tackle malaria, eliminate it as soon as possible. So let's take a look at what Hope Oboko will be saying when it comes to the issue of effort of the federal government in tackling malaria.
Program, the national coordinator, Dr. Godwin Ntadom, and the head of Advocacy, Communication and Social Mobilization Branch, Mr. Raphael Onyilo. Working with or collaborating with ACOMIN has been a good one, and working with the media that are supporting or working with ACOMIN is greatly acknowledged. The grassroots assignments that ACOMIN is doing is being acknowledged by the National Malaria Elimination Program. They don't take it for granted because they know that no matter how difficult or how difficult a terrain is, ACOMIN will penetrate to get what they want. So that is acknowledged, and we are looking forward to more collaboration with ACOMIN and the media. With your support, the media, the National Malaria Elimination Program, and its interventions will get to the grassroots. So we look forward to more collaborative efforts on the side of ACOMIN and on the side of the media. Malaria, according to some people, is a common disease. Some people will say common malaria, but it's not common. A disease that can kill, a disease that can make people to be absent from work, a disease that can make a pregnant woman to lose a pregnancy or give birth to a low birth weight baby is not a common disease. So it should not be taken for granted. So most times we rely on the media, on awareness creation, to let people know that this disease that they call common is not common because it's a serious illness. So we are looking forward to more collaborative efforts to bring malaria awareness to the knowledge of people, even at the grassroots. Thank you very much for all you're doing. National Coordinator ACOMIN, we acknowledge your efforts, and all the staff of ACOMIN, we acknowledge your efforts, and the media. We are not taking your activities for granted. We look forward to more. Oliver always asks for more. The National Malaria Elimination Program asks for more so that the prevalence of malaria will continue.
All right, Hope there, talking tough on what the federal government through the Federal Ministry of Health is doing to ensure that malaria is nipped in the bud. Something she said that is clear and needs to be written down if it's possible. Share it with those around you, your friends and family members. The fact that malaria cannot be commonized. It's not a disease that you commonize because it's responsible for so much mortality in women and in children. So now there are other development partners also working to ensure that malaria is eliminated in Nigeria. So we have also the interview of Ayo Pomoye, who is the national coordinator of ACOMIN. He will be telling us what is expected in terms of delivery at the community level, because if you must deal with malaria, you cannot avoid those at the community level. What should be expected from them, especially the primary healthcare centers? What kind of services do we expect? If those services are there, do we have the required personnel in terms of health workers to deliver those services we expect at the primary healthcare centers, which of course we know are domiciled at the community level? You also tell us the Basic Healthcare Provision Fund. It's a gateway that has been open since 2019 when, of course, the former Senate president, talking about Mr. Aki, where, of course, he cashed back the National Health Act, where 1% from the consolidated revenue is allocated to the Basic Healthcare Provision Fund, where the National Health Insurance Agency takes 50% and the National Primary Healthcare Development Agency take a chunk of 45%, and the remaining 5% is for health emergency. So what are we expecting in terms of the Basic Healthcare Provision Fund, where we know a chunk of it is channeled to the primary healthcare centers nationwide? Services at the primary healthcare centers, it's expected to also tackle the issue of malaria. So let's take a look at what Ayo Pomoye has to say on what is expected from our community, PHCs at the community level, and of course increased funding for the fight against malaria.
The healthcare system, the part of the healthcare system that is closest to the community is the primary healthcare facilities, that system. Unfortunately, it is that system that is the least funded, the least resourced, and is not being elaborated upon. And yet, it is the PHCs that serve the communities closest. So if we do not get the PHC system right and functional, it will be difficult for us to eliminate, talk less of eradicate malaria. So we keep coming back to the issues of the communities and PHCs. And today we'll be talking just a few thoughts on the PHCs. And we're saying that in the pursuit of promoting and achieving improved malaria and overall health outcomes, ACOMIN acknowledges the pivotal role of the primary healthcare system. And based on that understanding of the significance of the indispensability of the primary healthcare system, we will continue to direct our focus towards enhancing the factors that drive effectiveness at this foundational level. We all working together, the media, the National Malaria Program, our brothers and sisters, civil society organizations, the CCM, we need to ensure effective prevention, diagnosis, treatment, and support services for infectious diseases. And good enough, you had my brother from leading the HIV Civil Society in Nigeria speak on HIV. You cannot separate HIV from malaria from TB. That artificial separation, by the time you go to a community, you find out that we're all on the same boat, on the same rivers. So infectious diseases such as HIV, AIDS, malaria, TB, and other health issues is essential, particularly for vulnerable populations and those residing in remote and underserved areas. In order to reach these underserved populations, we have been implementing the community-led monitoring activities. And these CLM activities have recorded significant successes, which we have enumerated over and over. However, some challenges still remain that hinder effective service provision. These range from inadequate supply of malaria commodities, insufficient and/or dilapidated healthcare infrastructure, inadequate and inequitable distribution of healthcare workers. What you see, one, we have a very significant crisis in the adequacy of healthcare workers. A lot of kids that have been trained in the universities and colleges and polytechnics and schools of nursing, schools of health technology, are being trained now. Many kids go to school with one ambition. As soon as I finish my training, I'll leave the shores of Nigeria to go and find better pay somewhere else. So we have inadequacy. And we are turning out doctors, pharmacists, and they are not entering our own labor force, they are going out. That is one. The other issue is that even the ones that exist, the distribution is inequitable. You go to the local government headquarters, and you find 25, 30 healthcare workers in one facility. In some places, you go to the capital, state capital, you find 50 staff. We've seen that before, in one health facility. Then you go 10 kilometers out of town, and you find just one or two, or in some cases, none. We were visiting one healthcare facility just about 15 kilometers outside of a state capital. There's only one staff catering for the communities around. And that one staff was also writing exams. So there's one young boy from the village who will go and sit there. All that the young man does is to write the names of people who come to the facility. So anytime the healthcare worker comes back, he will go and find them to give them treatment. Now imagine you have, somebody has inflamed appendix, Abi, at that time, and he goes to the facility and they say, just write down your name. Go and buy Panadol and drink. When the healthcare worker comes, he'll come and find you. Something little would have become major. A child that has simple malaria, feeling feverish, by the time the health worker comes 2 or 3 days later, has developed really severe, complicated malaria. Why? This is not just because of the inadequacy of staff. Here is also the problem of the skewed distribution, that the staff that want to stay only in the urban areas, leaving our people in the rural areas unattended to. Then we have the Basic Healthcare Provision Fund. It's very good concept, very well thought through. But by the time you go to the practicalization of it, the disbursement becomes a challenge. If we all want to see improved health outcomes, then we have to together address these challenges. And that's why we're saying that these are critical and crucial for effective delivery of healthcare services, particularly in the areas of malaria, TB, and HIV. One other challenge that we have seen is that primary healthcare centers that have been resourced by Global Fund sometimes are taken off from the schedule. And you know why they are taken off and not giving products that others are giving? When they don't have staff, when they don't report Global Fund moves products there, and they don't get the data that is required. After a while, they will take them off the list of facilities that will receive the free malaria products. Now, what we are saying was not enough, now totally stops. And yet, the needs are there, the community members are there. But because if our people at the local level do not do their own part, then we have challenges. One of the things that lead to these facilities being delisted is poor record keeping and data entry challenges. When products are moved to a facility, when you use those products, for instance, ACTs, test kits, and other commodities that are provided by the partners, the facility is supposed to now keep adequate records and bring it back. But if month after month, those records do not come back, the implementer there becomes jittery, because it will now be attributed to a loss of commodities. So it is incumbent on the local government and on the primary healthcare system at the local level to ensure that adequate personnel are posted that will be able to bring up the data. So another issue that we have seen that we want to flag is that where we are working, mobilizing communities to access services in the primary healthcare facilities, and then there is an increased inflow or influx of clients. That is a good thing. When we're, for instance, now your reports go out, people listen on radio, on television, and they know that there are free services, they go there. But before we know what is happening, the capacity of the healthcare workers are exceeded. Because like we say, if there are only one or two personnel at the healthcare facility, they are the ones who will do midwifery services, they are the ones doing the pharmacy services, they are the ones doing, in some cases, even gardening. They are the doctors, they are the pharmacists, they are the laboratory scientists. And then we are sending more people there to access malaria services. Then the system becomes overpowered. So we are asking that there is a need, that they need to expand the existing facilities or upgrade them. The current infrastructure is inadequate to manage the growing demand for healthcare services at the community level. And when the system is shortchanged, it leads to delays in service delivery. It increases the work burden on the few staff, and the facilities are overcrowded. Then, again, we have spoken to this, the noticeable inadequacy of healthcare professionals across the different facilities. This now leads to suboptimal care for patients and work overload for healthcare workers. And when people, community members, try to access services and there is significant delay, then next time they have malaria, they don't want to go because they are not sure that they will receive the healthcare service that they need. A third one challenge that we speak of today is the delayed disbursement of funds from the basic healthcare provision funds to the facilities. In some cases, when we engage with the officers in charge of the facilities, they say, well, we have made our requests, and for over many weeks, we have not received the refunds that we need. And when they do not have the funds, when there is significant delay, it leads to ineffectiveness of the healthcare service provision. So all of these are challenges around the primary healthcare facilities. And that's what we are focusing on today. We need to have the primary health care system functional. We need to have them funded, and then we need to have them resourced. And who should do this? Health is on the concurrent list. The federal government is responsible. The state governments are responsible. The local government systems are responsible. And then we in this room are responsible. Our own part is to raise the alarm, is to blow the trumpet, is to talk to the decision makers. And that's why we are here today. So we are calling ourselves to action and saying, number one, to achieve significant progress in eliminating malaria, governments at national, state, and local levels, philanthropists, community leaders, religious leaders, and community members all need to take decisive action. A comprehensive strategy that includes preventive measures, improved access to diagnostic services and treatments, health education, and community partnership must be implemented. And like my brother here, Abdul from Nepal, did say, we need to have those three in place: participation, collaboration, and transparency, which is the no surprise. We call on government agencies, funding partners, and stakeholders to please, for the sake of all of us, work together to strengthen the primary healthcare system, ensure consistent and sufficient supply of ATM products, and this collaboration that we are asking for should extend to addressing infrastructural, health workforce, and funding challenges by improving and upgrading the infrastructure at our healthcare facilities. In addition, to increase the number of and improve distribution of trained healthcare workers and ensure timely disbursement of the basic healthcare provision funds. We call on communities, our traditional leaders, our religious leaders, community members, CBOs, community-based organizations, to please take charge of their own health outcomes and contribute significantly towards eliminating malaria as well as other preventable diseases. We believe that by taking these actions, we'll be taking significant steps in strengthening our own health systems, building trust in our own healthcare systems to deliver improved, accessible, available, and quality healthcare for all. We call on all, let's join forces to continue the quest to create a healthier future and eliminate malaria and other preventable diseases, which includes HIV, tuberculosis, and any other disease, communicable disease, from our communities once and for all. Thank you very much.
Okay. I'll say a very big thank you for spending your precious time with us on the program today, Health is Wealth. So much has been said about the need to tackle malaria and eliminate it. Your effort is required. Keep your environment clean. Avoid stagnant water. When the grasses are overgrown, ensure you trim them. And of course, do not allow the crown of the drinks you take to be left open. Ensure you trash them, because when it rains, as it is now, it gathers water, and that is the breeding place for mosquito. When they do, they now come back and look for you and deposit the plasmodium, and hey, you are really going to come down with malaria. And when that happens, it reduces your productivity. Of course, when you call your office and take permission as a result of malaria, it reduces what ordinarily you should contribute to the growth of your organization. And of course, the killer instinct in malaria is still very much out there. That was emphasized by Hope Oboko, and we must ensure that pregnant women go to antenatal, ensure that you are tested before you take any drug, and for children, let's ensure they sleep under long-lasting insecticide-treated net. Until I come your way again, I am Joseph Kadri. You have a nice